Back when kidney transplantation first started, they would only accept the healthiest for a transplant. In fact, diabetics were excluded because they had such a bad lifespan. And now, of course, diabetics make up 20 to 40% of the patients that we transplant here at BI Deaconess. So as the procedure has gotten better, the number of people who qualify for it has increased dramatically. In the early days of transplantation of kidneys, it was felt important that a patient actually be on dialysis for a certain period of time to make sure that they were a good candidate for a transplant, that they were compliant, they would follow along with the regimen of dialysis, and that the patient had an understanding of what they were trading off for in terms of going for the transplant, that the alternative was dialysis. But over time, especially as the wait list got longer and longer, and it took a lot longer to get a transplant, more and more patients began getting transplants, mostly live donor transplants, prior to ever needing dialysis. So as they approached end-stage kidney failure, but prior to starting dialysis, they would get a kidney transplant. In looking back at large databases throughout the United States, researchers have found that people who got a preemptive transplant before going on dialysis actually did better. They lived longer and the kidneys survived longer. It's not exactly clear why this is true, but it was found that even 6 months on dialysis resulted in worse kidney outcomes and worse patient outcomes. So there's been more and more of an emphasis, especially at this center, on preemptive or pre-dialysis kidney transplantation. The keys that go into that are, number one, early referral. We have to know who you are before you actually start dialysis. Some people don't know they have kidney disease until they're told it's time to start dialysis. Obviously, with somebody like that, there's no option for a preemptive transplant. But other people know kidney failure is coming and get referred to a transplant center in a timely manner and have a live donor willing and able to give them a kidney. And in those people, they can bypass dialysis altogether and get a kidney transplant. They still have to take the same immunosuppressive medications with all their side effects, decreased ability to fight infections and certain kinds of cancers, a little bit more diabetes as a result of these medications. So there are downsides to immunosuppression, but in fact patients who get a preemptive transplant do much better than patients who are in dialysis first. So we've really made it a priority at this center to encourage preemptive or pre-dialysis kidney transplantation whenever possible, and to also encourage live donation whenever possible as a means to shorten time on dialysis. Less time on dialysis is more time on a week-by-week basis to enjoy your family, to work, to do whatever you want to do, and less time on dialysis is actually life-extending and life-saving.